So, Dr. Martin, how do you define somebody who actually needs human growth hormone? As I showed, our levels.
How do you define someone who needs human growth hormone?
How can you tell
Is
if
it
they
going to
can
help them
benefit from it?
or turn them into
Excellent question.
morons?
We do a complete endocrine workup. The next thing we do is we do a series of cancer antigens. We want to make sure that this woman is cancer-free. We want to keep her risk at a minimum. And so the responsibility really is upon me to make sure that the efficacy of the drug we're using works.
And Dr. Martin, if Judy's happy with her treatment, how long should she stay on it?
In Judy's case, it would be an indefinite treatment. It would continue for many decades.
So you're saying she ought to be on it forever?
That's correct.
I mean, forever's a long time.
We hope it's a long time for Judy.
But we've had experience with other types of hormone replacement therapy. Yes. For example, where we're still raging, in our fight pro and con this.
Exactly.
I mean, whenever I'm told to give something to somebody forever, or take it myself forever, I always have a little bit of trepidation that I'm playing with fire. Do you have that concern?
Is there any trepidation about you playing with fire if you got to pull off your pill?
Her on a regular basis.
They say they're for hire. They say you got to do them. You got to do it for life. What's it going to make you feel like?
And what do you say
Does it feel like a plight?
to folks who say that Judy is putting her life at risk, that actually giving HGH is risky, is dangerous?
Yes, I think there's a lot of misinformation there, sitting there. We really do need to look at the studies. I think that becoming familiar with what's there, with the data, we have some very good studies that we should really get to know this.
All right, so obviously, I told you ahead of time that we're going to invite two opposing perspectives on this, because there are two opposing perspectives in medicine. So Dr. Stuart Wienerman is joining us. He thinks that HGH should not be used
There are two
for
opposing
anti-aging.
perspectives.
My concerns are that
medicine
this is
always.
information
You got to look at them all.
long-term safety
so
data in otherwise
you'll
healthy
feel
people.
like there's
it has
a
only
way.
been studied well and approved for patients.
What works for
with
you, you decide.
Established growth hormone
try
deficiency,
to do
generally in
what
the
you think
setting of
is right.
pituitary disease. We don't have any large outcome studies. We give a group of patients placebo or drug for many years and look for things like diabetes, heart disease, potentially cancer risk. The short-term risks that have been identified in studies, even in populations such as patients with pituitary disease that is FDA approved for, include swelling, extra body fluid edema, joint pain, carpal tunnel syndrome. Major concern for me is that it induces insulin resistance, elevates blood sugars, and increases the risk of diabetes. There are somewhat less clear
Some short-term
risks
illnesses
for
can
heart issues,
be
heart
catalysts
disease,
or stepping
and
stones
even
for
potentially
longer-term
cancer risk.
illnesses,
And Dr. Martin, I go
even
back to you,
diabetes.
just
So
to
if
be
you see the
clear
signs
on
of one
I know that a lot of
that
the
could lead to
pushback
the other,
from
it's
organized
important
medicine
to recognize
is that
them
physicians in this field are
begin
often
to observe.
doing it as a
If
money-making
you can
venture.
do that and catch
So
things
can you
early,
address
you
some of
might
the
have a
concerns
different
about the
form
monetary
of
incentives around giving human growth hormone?
Exactly. This is an issue.
Things you
It's
do
a serious
regularly.
problem, and we see